With my PD time, I did a Clinical Informatics Fellowship. That's a 2-year fellowship. It was actually, sponsored by the Department of Surgery. Um, I had funding for that, thankfully, working with Dr. Forrester and Dr. Grantroff. One mechanism that helped fund this fellowship was a grant called Welcome Leap, which is a global surgical education grant focused on implementing health informatics technology to the global south and focusing on improving the global surgical workforce. So the kind of things that I've been pretty excited about and working with biomedical informatics teams as well as surgeons from other countries to see how we can partner. So there's a difference between biomedical informatics, computer science, and clinical informatics. Clinical informatics is really focused on really the clinicians um, getting machine learning algorithms, interesting technologies, online platforms, getting that to the bedside and how to effectively deploy that so that you can have clinically meaningful outcomes, so that you can have providers that are happy with the technology. So I have a strong interest in doing trauma critical care fellowship after residency, and I was trying to think of other ways to leverage my interest in quality improvement with my surgical subspecialty of choice. And I heard about this fellowship that we had at Stanford. No surgical resident has ever done it. And so I was curious about that. And really, I was at the right place, right time, getting, the right mentors to advocate for me to get into the fellowship. Dr. Spain was crucial in sort of paving the way and kind of making it possible. Um, but I really have a strong interest in using various technology, including the electronic medical record, all the tools and cool toys we get to play with in the operating room, how to better understand that, refine it, and make our clinical workflows better. The main group that I've been working with is a resident safety council. I've been the co-chair for the past year. We work on projects from language equity, patient safety, hospital readmissions, and hospital communications through the Volt app. And it's just really awesome to work with residents from all walks of life, all different types of residency programs. They're all really focused on trying to improve not only the care of patients, but also kind of the experience that residents go through, just making it better for all providers. Um, Within the Department of Surgery, I've done a lot on standardizing a lot of the types of discharge documentation. So one project that a lot of the residents in my class know about, because I've text messaged them a lot about it, was the discharge summary standardization. So having some background with building things in our electronic medical record, was able to create a standardized template and then implement that across the whole department. Um, Kind of along that line for discharge navigation is standardizing the patient instructions that our patients go from surgical teams go home with. Unfortunately, a lot of patients who speak languages other than English often aren't getting a translated document, even though we spend a lot of time communicating with them with in-person translators. And so after standardizing the dozens and dozens of customized templates of patient instructions that have built up over many years, standardizing those into a single list of kind of department approved templates. We're in the process of getting these translated by our Stanford Translation Services team so that patients can have language concordant care as they, before they go home. And ideally, this, intervention could help prevent possible readmissions too. I love, working with multidisciplinary teams, working with folks from the C-suite to various administrators. It's been a lot of fun, but my passion is really being in the operating room. Some of the projects that I didn't get to talk about was using machine learning models like that actually use computer vision to automate and detect parts of surgical video, and how that can be leveraged to, enhance our surgical education, getting, the right clip of the video at the right time so that you can have, can have opportunity to get feedback from one of your mentors. So one of my what I'm excited about after residency is still working with residents, being part of surgical education, teaching residents how they can best optimize their performance, reviewing videos with them, and making that video review process much less painful than it was for the people decades ago. It should be something smoother, something more efficient, faster to review video, so that you can get through the day, and also improve your technical skills. So academic surgery is something I'm really excited about, and working with residents in the future.
Fabulous. And